Hi, today we're going to talk about how to care for your laceration. A laceration is a cut or wound that goes through the skin and tissue. It's important to care for lacerations correctly so they don't get infected, which could lead to a much longer healing process. We have 3 goals when caring for a laceration. The first is to close the wound, the second is to prevent infection, and the third is to keep the wound clean and dry. Some lacerations may not require closure. Others need to be closed to prevent infection. These cuts can be closed using stitches, staples, wound glue, or adhesive tapes on the skin. Each different method of closing the wound has its own set of instructions on how to keep the wound clean and dry and heal properly. For stitches or staples, it's important to keep the wound clean and dry, to change any bandages at least once a day or if they become wet or dirty, to wash the wound with soap and water at least 2 times a day, and make sure to dry afterwards. Apply antibiotic ointment after cleaning, for example Neosporin or Laceration. You can shower normally after 24 hours. Do not soak the wound until the stitches are removed. Only take the over-the-counter or prescription pain medications as directed by your doctor. Have your stitches or staples removed by a caregiver. For wound glue, you may lightly wet your wound in the shower or bath, but do not soak or scrub the wound. Do not swim with the wound. Avoid periods of heavy sweating until the wound glue has gone on its own. Do not apply liquid, cream, or ointment medication to your wound while the wound glue is in place, because this can interfere with the glue. This includes using Neosporin or Laceration. Dry the wound after getting it wet. Avoid prolonged exposure to sunlight or tanning lamps to prevent darker scarring. For skin tape, keep the wound clean and dry. Do not get the adhesive strips wet. Bathe and shower carefully. If it gets wet, pat dry with a towel. The strips will fall off on their own after 5 to 10 days, so do not remove the strips that are still on the wound. Another way to prevent infection is to get a tetanus shot. You should get a tetanus shot if you can't remember when your last shot was, or if you've never had a tetanus shot before. Tetanus shots can cause your arm to swell, get red, or to feel warm, which is common and not a problem. These shots help prevent getting a tetanus infection, which can be very serious. Sometimes, if lacerations are large enough, they can leave scars. Scars aren't dangerous, but they can be minimized by preventing infection and covering the wound with sunscreen during the day for a full year after the injury. You should call or return to the emergency department if you have redness, swelling, or pain around the wound, if you see a red line on your skin traveling away from the wound, if you have yellowish white fluid or pus coming out from the wound, if you have a fever, if you notice a bad smell coming from the wound or dressing, because these can all be signs of an infection. Also return if your wound splits open and starts bleeding, notice something coming out of the wound like wood or glass, or if your wound is on your hand or your foot and you can't move a finger or toe. It's also important to seek medical care if your pain is not controlled with the prescribed medication, if you have severe swelling around the wound, if you feel weakness or numbness in your arms or your legs around the wound, or if you develop painful lumps near the wound. Remember, all of these are signs that you should return to the emergency department or see your physician. Hopefully, by following the steps outlined in this video, you can get well soon.